The Thought Leadership Institute is building what will one day become the global digital library of human development and coaching. Respect. As a sociologist, Alicia is interested in pathways of interconnectedness and integration and asks questions on how to enhance relationships within ourselves, with each other, and with our own home. Previously, Alicia was consulting with organizations on social change models in the areas of cooperative business models, sustainability, alternative agriculture, social movements, and coaching research. Alicia holds a doctoral degree in sociology from the University of Kentucky. Alicia, good evening, welcome, and thank you for joining. Now let us connect with you on a more personal note. We noticed when we talked to you, Brankica and I, that you cherish social well-being, you love vegetables, you work with agriculture, and coaching. So where's the secret thread between these three things, and why coaching in your life?
Well, I love vegetables. Kale is my favorite vegetable, and I guess it's something that contributes to well-being, right? I think we're all in the coaching field because we're interested in making the world a better place. And I think the coaching model is definitely a very effective way to contribute to social change. So you have to eat your greens to contribute to your own personal well-being, along with all the other aspects that contribute to well-being. So that's, I guess, the connection between kale, greens, vegetables, and coaching.
You notice there's a beautiful and deep connection there. So I was tempted to start with this. And now, as I said, ICF Serbia chapter volunteered to facilitate this webinar on this very important topic for us. And I will now pass the floor to my colleague Brankica to introduce you to our subject this evening. Brankica, please.
Oh, thank you, Jelena. Of course, we all have been living since a year ago in the world of pandemic, illness, health, public health, and consequently mental health. And mental health is the topic that we as helping professionals have a great interest in. Today, we have a great opportunity in this ICF members only event to think about mental health and how is it linked to our profession. We live in the COVID world and we are vividly preparing for post-COVID one. And today we have a great honor to have Alicia with us because she is going to present a framework in which mental health, psychotherapy, and coaching are put together and then interestingly separated on a clear base. Very useful material for us, as I said, as we are preparing for post-COVID era. Just remember, I would, before I forget, I would like to ask you to do not hesitate and post your questions in the chat box so we can talk about them later and have an interesting and fruitful discussion. Alicia was mentioning that you can even raise hand during her presentation if a question is of great importance to be answered at a particular point. So please do so. So with no further ado, Alicia, thank you in advance. We're looking forward to learning from you. Please, we are happy to have you with us and share your view on mental health and coaching.
Great, thank you. Well, thank you, Elena and Branka and Ala, for this opportunity to share this information with your chapters. As we have had an opportunity to meet, it's clearly an important topic and makes sense why people are wanting to know more in this day and age with the increase in mental health issues across the globe, since we're all experiencing the global pandemic in some ways. So this is an important topic, and you know, I'm sure there's going to be lots of questions that we can answer along the way. So again, my name is Alicia Hullinger, and greetings from Louisville, Kentucky. So the nice thing about virtual meetings as we get to meet across the world. So we're just going to go through this. We should be able to get through in an hour, but if we need to stay longer for questions, I know that it's important. I do have time to stay later. So these are the questions that Elena, Branka, and I had sat down and chatted about as far as thinking about coaching and mental health in this COVID and now post, as we transition into the post-COVID era, and thinking about what is the difference between coaching and psychotherapy, because those can sometimes get blurry and confusing for people who are working in the coaching fields but don't have any type of psychology background and are, you know, just trying to figure out the difference between, okay, as a coach, what is my role versus somebody who is in the field of psychotherapy. And then as we are in this COVID era, what are some of the topics that are coming up that are related to mental health and coaching? So what are coaches seeing? And that's where I would love for you all to jump in and share. And just thinking about, as we move forward, how can coaching be positioned in the world of mental health? And so thinking about mental health, that's just one aspect of well-being. And that's what I mentioned earlier is the significance of well-being as we think about the whole person development. And coaches are able to contribute to whole person development. Mental health is just one aspect. And so we'll talk a little bit about, you know, when the boundary shifts into an area that is more psychotherapy than coaching, but coaching contributes to all aspects of well-being, including mental health. So we will look at the signs and symptoms of some of the common mental health issues. Depression and anxiety are, we'll talk about, differentiate between mental health from a bad day. We all know that we have a bad day, and just because somebody has a bad day doesn't mean that they need to go on to a therapist. And then looking at the barriers that we might individually have, our own biases or assumptions, or perhaps are just our nerves in bringing up this this subject, and then how to have that conversation. So, you know, looking at the global context of mental health, we had there was an increase. The trend of mental health issues was on the rise before the global pandemic occurred across the world. And now we have this global pandemic that has really shook up the entire world. And so it's really intensifying that trend and escalated that trend. So mental health issues are continuing to be on an increasing rise. So COVID-19 has really disrupted mental health services across the globe. And unfortunately, the services that are available are just not there. And so we are seeing a growing awareness of mental health issues, which is a good sign, but unfortunately, the help that is available just is not matching the need. And so it really is a global issue. More than 8 in 10 people with mental health issues are in low-income countries, and they receive no help. And as I mentioned, anxiety and depression are really the top 2 mental health issues and across the globe. So this is really just something that we all need to be aware of for ourselves, for our clients, and just make sure that we have the resources available to support our clients. So again, mental health is just one aspect to well-being. So if we look at the global statistics, the World Health Organization estimates that depression and anxiety disorders are essentially right up there with cardiovascular disease. So these are the top global health issues that we are seeing. And if we look at the US context, we have 1 in 5 adults who experience mental illness sometime in their lifetime, and 18% have an anxiety disorder, where only less than 20% actually go out and seek help because of the stigma oftentimes in the US, but also in countries across the world. There's still a stigma when it comes to mental health. So people are not necessarily knowing what to do or seeking resources. So less than 10% of people really receive treatment, and that's a concern. So how can we define and think about mental health? So if we think about mental health, it's really about the level of functioning that an individual is experiencing in their day-to-day. So it's that impairment or functioning piece. So if we can think of it on a spectrum as far as somebody who is functioning day to day in their emotional state and behavior, and they're able to do their day-to-day activities. It's when they're not able to do their day-to-day activities that there could potentially be something underlying going on. So if they're not able to show up for work or just really carry out their daily activities, and self-care being a very clear indicator as far as not fully functioning, then that's something to really make sure that you're aware of. And so this is just one way to think about the difference between psychotherapy and coaching. These are just some guidelines, and we also know that sometimes it can be a little bit more gray than this, but this is a starting point to help think about and be aware of mental health issues and when somebody might need to see a therapist. So first of all, thinking about psychotherapy, that's a licensed professional who has gone through specific educational and clinical practice to really do this type of work. And it's really focused on diagnosing and treating an illness, whereas coaches do not diagnose or treat a mental health illness. So that is one indicator and difference. And, looking at psychotherapy, it's going to be based on established theory along with evidence-based methods of practice. Again, psychotherapists go through clinical work and practice, and this is used to treat the different classifications of mental health issues. So depression, anxiety, substance abuse are the top 3. Addiction, these are some examples of the different mental health issues. Whereas a coach is really working with their client in a supportive, facilitative manner. A psychotherapist is working in a remedial manner, which means they are working to correct something, whereas a coach is partnering with their client in order for the client to come up with their own approaches and solutions. So it's that partnership relationship. And a psychotherapist is going to focus more on past issues. It's going to look at, emotional and cognitive self-regulation and issues from the past, whereas coaching is focused on the present and moving into the future and focused on action and growth. It's really that learning and growth mindset that coaching is working with. So we all have a bad day, right? And so how do you know if a client's just having a bad day or if there's something more that's going on? And I think just asking questions, which is part of the coaching process, is going to be important, and just get a better understanding. Are they off and they are able to acknowledge that they are off and having a bad day, or are they not aware that they're having a bad day? And then also the duration. Is it just one bad day, or have they been having multiple bad days that have been reoccurring, and the intensity of those bad days? So duration and intensity are also some good indicators to think about when somebody's having a bad day. And then are they able to really say, you know what, I'm having a bad day and I just need to rest, or I just need to go and, go get some physical exercise and come back at it once I've been able to just get it all out of my system. So they're able to recognize that it's just an off day, and they know how to, rest, reset, and come back and have a normal functioning day. So these are just some things that, in asking questions, you can figure out if this is just one off day, and go from there. So again, using coaching observation skills and seeing if there's something that's going on that's underlying, and thinking about the client and their baseline functioning days, right? Are they presenting themselves in their normal functioning way, or are they starting to not take care of themselves? And I know in this day and age, it might be a little bit harder to see the presentation with not being able to necessarily be in person, but these are some things to see if they are significantly changing what they normally look like and show up as. So their presentation, what's going on at work or at home, are they not able to show up and do their normal work tasks? And are they not really able to do their basic day-to-day chores or tasks at home? Are they not taking care of their family, or are they just really isolating themselves from their family and friends? So these are just some things in asking questions that can help coaches understand what's going on. Are they all of a sudden having some financial issues, not taking care of their bills? Are they not able to communicate, and are they just really getting stuck and in their type of communication? Are they having really excessive worry and guilt about different things, or a sense of loss of hope? And then health, are they starting to over or under eat? So are their eating habits changing, or their sleep habits changing, whether it's too much sleep or not enough sleep, and looking at their day-to-day habits, how those are changing, if they're significantly off on for a period of time where they are off again, that is more than just a bad day. And so thinking about, a coaching session and what some potential signs might come up in a coaching session, if the client is not able to focus on the actual session and the agreements that you and the client made in the beginning, if they're starting to report very low assessment scores because they are just not doing well physically, emotionally, or psychologically. If they're really just getting, again, stuck, or they're just not able to move forward, not able to think critically, not able to respond to questions, not able to come up with their own insights or answers or their own questions, and they just really want you, the coach, to just tell them what to do, and they've, in a sense, have just given up on the coaching process. Or intense emotions, if again, intensity is a good indicator. So if they are all of a sudden having very intense emotions, whether they're just crying excessively or they just become very flat, and is this, you know, different from what they normally are. So, you know, if you suspect that a client might be having some mental health issues outside of coaching, and again, thinking about the code of ethics and what is within your scope and what you're comfortable with, and what you, what type of training you have, if it is outside of your scope, then you know what to do, that it no longer fits within the coaching agreement. And so, you know, with the code of ethics, it's referring the person on to another professional. So I know we were talking about this. It just reminded me of, you know, so we can think about somebody who might come to the coaching session, or somebody who is going to their, we can use the metaphor of the medical field, right? So if there is somebody who is going to their general practitioner doctor, and they are complaining of chest pains, for example, and you know, the general practitioner asks some questions and just learns that this person is just having a lot of chest pains, and it's been happening for the past couple weeks. Well, that general practitioner is going to refer them on to a cardiologist, because that's outside of their specialty. So same with coaching. If it's going to be outside of your expertise, then it's a matter of referring them on to the right health professional. And for example, if somebody came into the coaching session that you're in and is saying, oh, I'm really having some chest pains over the past week, you wouldn't necessarily refer them on to a psychotherapist. That's most likely you would start with their general practitioner, so they could get the physical help that they need, because that's an indicator of something physical that's going on. There might be some underlying mental health issues because it's all interconnected, but you would at least start them off with referring to another health professional. So based on that, you have three options. You can continue coaching if the client says, you know what, you're right, I should go see my health professional, and I will do that. And I want to continue working on our coaching practice. So that's one option. You can postpone it because the client says, yeah, you're right, I probably should do something about it, but they don't really get around to it. You might just say, okay, well, you know, once you have done that, then let's start back up on the coaching. Or you just terminate it if they really are outside of the scope of coaching practice, and they really have an issue that is not going to be served through coaching, then it's okay to stop the coaching agreement and just point them on, and you know, make sure that you have the resources to refer them on to other professionals. And so just as a coach, and making sure that you are equipped and ready to make a referral, it's definitely important to have some resources handy. So if you have you know, a list of a few mental health professionals, that you can recommend as a resource. It's also helpful to just talk through some of these different issues with a mentor or a supervisor or a mental health professional. If you have some mental health professionals that you would refer a client to, pick up the phone and call them yourself and just talk to them to get a little bit more insight. And, and then as we talked about, it might be, if this is the first time that you've had to make a referral, there might be some emotions or concerns that come up with you. And so it's a matter of just, having the internal coach to ask those questions of yourself of why you might not be feeling comfortable to make the referral. And obviously it might be because you lose a client, and that could be a loss of income. Well, that is not necessarily in service to the client. And so, asking these questions of yourself will help you to have your own deeper awareness, so you can be in service to the client. Or you might be afraid or concerned that you would offend them if you brought it up. So these are things for you to bring your internal coach and ask questions of yourself. And so again, practicing this with a supervisor or mentor is also another resource. And so, making the referral, it's just going into your coaching mindset. The skills of a coach are really the skills that are helpful in making the referral. So through empathy, care, concern, setting a direct, calm, positive tone, and making observations, pointing out specific behaviors that you have observed. So again, starting with some things, observations that you have noticed in their behavior, and see what their thoughts are and how they are responding to your observations. And just making sure that you have the resources available to offer, so you can say, with these behaviors, I'm not necessarily the right professional that could help you in this situation. And so I think this situation would be better served by a mental health professional who can really help you in this area, because they have expertise that I don't have. And the biggest skill set, the most important skill set, is just listen and allow for silence. So listening to understand is extremely important.
Alicia, sorry, I apologize for interrupting, but Povilas is asking a question right now, which is referring to what you are talking about now. And basically, it's not the question, it's something that he would like a comment on. So it says, so how are you? Now is not just regular hello. We as coaches should be especially careful about that, I assume. What are your thoughts on this?
So the question is asking about whether or not coaches should be asking, how are you?
It says, how are you now is not just regular hello when we make a referral. Povilas, can you just help us understand your question better? We coaches should be especially careful about hello, and how are we phrasing hello? That's your question.
And I'm wondering if what the concern is there behind that question.
Okay.
So, hello to all. It's not just like a question, but a smaller observation. Like during the coaching session, it is like we should be more careful when we are asking just, hey, how are you? It's just to dive a little bit deeper, to understand, to listen, to understand what is the answer. It's not just the regular hello, how are you doing? Because how are you now? It's very, no, it's like tiny road, if it is possible to say like this.
I mean, like, hello today is like you're going in a minefield. You don't know what will be the outcome of that question.
Yeah,
That's the way I understood it.
yeah, correct.
Yeah, but
Well, I think yes, I think it's good to notice that in yourself, right? To start again, having that internal coach that, are you having these nervous concerns in yourself by asking a simple question, right? So that is the first step. And I also heard that you said that it's important to, when asking that question, it's really to listen, to understand, and to go deeper. And so what are some other ways as a coach, other than listening to understand, what are some other ways that you can go deeper beyond the hi, how are you? So I think what I heard was just a lot of coaching skills in there, and potentially just, we are all, I think all of our emotions have been elevated to an extent with COVID, and it's important for us to recognize that within ourselves, right? Like Yelena said, it's a minefield sometimes when we're asking some simple questions because of our I guess new normal. Does that answer the? Well, I think it was more of just an observation and not an answer.
Thanks.
And just, thinking again through these conversations and, having that direct, calm, empathetic conversation with care, it's really about normalizing psychotherapy, right? It's really just because, again, in many places across the world, psychotherapy, mental health issues are viewed as a stigma. And so if we can just normalize that people, that mental health issues are an issue that need to be dealt with a mental health professional, then, hopefully it increases awareness and gets people to recognize that, that there's help out there, that they aren't alone. They're not the only one who has mental health issues. They aren't in this by themselves. So that's, I think, a big part of the conversation. And then just being direct to make the referral and just say, well, based on what I've seen, I'd like to consider you to, consider speaking with the mental health professional that is a resource that I've have information for, and just ask, would you like to contact them? Are you willing to go and talk to your doctor? Again, if it's the chest issues, then it would be talking to your general practitioner doctor in the next day or two. So, and then making sure that you follow up on the suggestion, just to figure out what the next steps are, whether it's to continue coaching, to postpone, or to terminate. And so just, again, asking questions and keeping the lines of communication open. So yes, it's probably more than just a hi, how are you type of question in order to go deeper. And I think this is where we wanted to open it up for discussion and just see, what you're experiencing and what questions that you have as we move into this new era, post-COVID era. And as we know the reality that mental health issues are on the rise. This was a trend before the global pandemic, and it's a continuing trend that has just increased significantly with the global pandemic. So how can coaching be positioned in the world of mental health is, up for discussion at this point, or any other questions that we can really take a look at when thinking about the profession of coaching and the world of mental health. So I'm curious what what the audience, your thoughts are and questions that you have, or some examples that you want to share.
So the questions have been started even during your early presentation. So the first one from Nena was, which countries are in the 7% that are not affected, that you mentioned in your, would be interesting to know their practices and mentality of how they cope. That was from the beginning of your presentation, I assume.
Okay, I do not know, because those are global statistics. So I have not looked at the statistics at a country level. So those were global statistics by the World Health Organization. But that is an interesting question, because the modalities are going to, there's probably going to be some similarities, but differences from place to place.
Yes, it is very interesting, because the numbers that you also mentioned about the cost of anxiety and depression on the global level were impressive. So the practices that actually support a smaller level of mental disorders in mental health and better mental health.
Right. And if we think about it, so health services are just not available, and matching the need to support mental health issues. And with the global pandemic, we also know that health services have been compromised across the globe because of just the increase in the use of health services. And so that has really edged out opportunity, the services for available for mental health. So that is just also part of the current context that we're also dealing with.
Yes. And there's another question really refers to how can coaching be positioned in the world of mental health. One view on that comes from Elena, and she is asking, which kind of depression tests can I use as a coach, or I can't?
Yeah, so that would not be something that a coach can use, because that is diagnosing, and that is very clearly in the field of psychotherapy that requires specific type of training.
Okay. And Carmen is asking your thoughts on coaching as additional support in cases of non-substance addiction.
Mm-hmm. Yes, I think coaching can definitely support in mental health issues. Again, making sure that the coaching agreement and the focus of the coaching session is within the scope of coaching. And somebody might have a mental health issue such as depression or anxiety that they go and work, or even substance abuse that they work with a psychotherapist. But if it's I think that they can be complementary.
Okay, thank you. And I'm curious, there's the questions that we've seen so far. And I'm curious about when we talk about the positioning of the coaching in the world of mental health. How do we do it? What is the role of regulation, of legal part in that sense? In the countries where there is no regulation, and let's say coaching is a new practice, how is that? Do you have experiences that you can share with us, or some?
That's a good question, because regulation is going to look different from country to country. So I think it is important to know what the regulations are in your country, because there's going to be, the field of psychotherapy is regulated, whereas the field of coaching is not. And so, and that looks different from country to country. So it's just a matter of going and doing a little bit of research to understand what your local regulations are.
And if coaching is not regulated, the complication is there's another level of, let's say, possible complication. That we as ICF coaches are binded by ethics. and we have ethics to rely on, let's put it this way, but not all of the coaches on the market.
Yes. Yes. So I think, you know, ICF coaching being really taking the lead in that space has a code of ethics, which really is important piece to this puzzle, right? Is because the code of ethics, it is really a great place to start in thinking about, you know, the role of coaching and mental health, and looking at, is it something within the coach's training and expertise, and within the coach's scope, or not? And if it's not within their scope of training and their practice, then the code of ethics is very clear that that's outside of the agreement of coaching, and either that, you know, referring them on if it's to another professional, or revisiting the agreement, for example. So the code of ethics, I think, is for ICF coaches is a very great tool to stand by.
Okay, thank you. Povilas is asking another question. Maybe there are some most usual referrals from coaches to therapists, Gestalt, cognitive therapy, etc. in the last period. Are you aware of that? Can you share with us?
I don't.
Usual referrals.
Yeah, I don't have statistics on what that is looking like. That would be an interesting question to ask and survey to do, but I don't have any data on what that looks like. But we can, you know, we can make some inductive conclusions based on the fact that we're seeing a trend in an increase in mental health issues. There is a growing awareness, and so one would suspect that there are more referrals that are going on between coaches to psychotherapists, but I don't have data on that.
To particular schools and practices. Yes, and now I would like to ask you, because I'm coming back to your question, how can coaching be positioned in the world of mental health? What is your position on that?
Well, I think, you know, coaching contributes to the whole person development, right? And so mental health is something that is part of the whole person development. So coaching can contribute to increasing awareness within individuals, and that increasing in awareness gives them the ability to recognize when things are going on within inside themselves. So just I think coaching contributes to the coaching mindset, right? And that is a really important part and piece to the mental health question, but also just the overall well-being. So I think coaches can just really emphasize that it's the whole person development that coaching contributes to, and that it's really about that learning and growing mindset.
Yes, it's more in the field of andragogy, the science of the adult learning.
Yes.
I recently read, I would like to share that in 2015-16, that adds to your comment that even before pandemics, the depression and anxiety were a major cause of how did you formulate malnourished, well, that is 1 trillion of costs of per annum for the work environment. What I read was that in 2015 in US only the scope of antidepressants prescriptions were 400 times larger than 20 years before.
Mm.
So well-being, really, not only mental health or illness, is really a topic that is raising in importance, and the self-awareness and learning is a big theme that coaching can contribute as you said at the beginning, create a better world. Elena, would you like to add something? What are your thoughts on where are we now?
I would like to maybe add something here, if you like. I mean, the goal of our session tonight was to clarify these lines, but to really empower our members and coaches to feel more comfortable in this scary zone. And now that we are coming basically to that we are approaching slowly the end of our conversation, I would even like to emphasize more this position of coaching. So right now, if you were on a field and if you were working in this very disruptive place, do you see any examples like of the borderline cases that one as a coach can come across and still stay still and feel comfortable to deal with, not to think that this is all ready for psychotherapy? Because here we are mostly trying to be very careful and not to cross the line outside of coaching area. But we want to expand where is the coaching area in all this, because as soon as we bump into more complex and serious psychological context in this specific environment now, people are hesitating and wondering. And what are your thoughts on that? You know, how can we feel more comfortable and empowered now that we refreshed on the understanding of what are the borderlines here?
Yeah, that's a good question. And I think the simple answer is that we just have to continue our own coaching practice for ourselves, right? Is that we have coaching is a practice, it's a lifelong practice. And we as coaches need to model the way in our own exercise, if you will, of the coaching mindset. So just like physical exercise, you have to keep at it if you want to stay fit. Because if you stop your physical regiment, you're going to lose some of that muscle and some of those things that you've been working on. And so that's, I think, the similar, we can think of coaching as well. So we have to make sure, again, to make sure that we're working on our own internal coaching and creating our own awareness through different types of approaches. So I would ask questions as far as, you know, what type of education is helpful for the coach, and thinking about what are some of the different ways, resources and tools that would be helpful for the coach to seek out for their own awareness. And I think having a mentor or a supervisor is also a valuable resource in that process. And then also I think coaching can really think about this from a collaborative perspective, which is, it's okay to have these conversations with mental health professionals. Imagine if we were able to have some dialogue with mental health professionals and how that would enrich both coaching and the field of psychotherapy, because we as health professionals, health services professionals, are wanting the best for our clients, whether we're a coach or a psychotherapist. We're there to, you know, contribute to the client's well-being. So, you know, let's open up those conversations and you know, learn from one another. So that's, you know, a simple answer when you're working with borderline cases, but you know, being able to know, oh, I'm not sure, and recognizing that uncertainty within yourself, then seeking out resources to help find a deeper awareness in that situation.
Thank you.
Thank you. And because we're both sides, psychotherapists and coaches, we're both in helping professions. So that links us to the next question, which says, in your experience, how many percentage of coaching clients, not just in COVID times, would need a therapy rather than just coaching?
That's a good question, and we don't have data for that. That's a good question, and that's something that, yeah, I have not seen any type of survey data that has been taken on that.
Okay. And in Thought Institute, are you dealing with this issue? What is the scope of activities of Thought Institute?
So the Thought Leadership Institute is doing, it's a new family organization, and we are in our startup phase. And so the scope that we're looking at is looking at well-being within the United Nations Action Plan for Sustainability. So we're looking at how coaching contributes to the UN's Action Plan for Sustainability. So we're taking a very holistic, interconnected perspective as far as coaching's role in human development, right? So coaching is one application that contributes to human development writ large. So that's what we're up to. And as Yelena mentioned in my bio, we're looking to build a digital global library of human development and coaching. So that is, we're starting in that process to build that digital global library, and we'll be hosting convenings with thought leaders, subject matter experts who can really talk to the UN's Action Plan of Sustainability and think about the role of coaching and how coaching influences well-being, and how different facets of society influence coaching. So thinking about the future of coaching and beyond.
Okay, thank you. So we are coming back to well-being and sustainability and the role of coaching. So
this is the great insight, because we would like to treat this first webinar as just the first small step in staying in touch regarding all this big scope, because basically we are on a completely new learning curve right now. And that's great to hear. Sorry, Dragica.
Yes. Well, I've just read the Nena's new question, so I would like to, it adds to this. It says, I have a supervisor who is in original profession a therapist and also coach in addition to that. And it's very rewarding, especially in borderline questions I have about the dilemmas we are talking about today. So it's like maybe a good practice for and good advice for us to keep it sustainable and contribute to what we as coaching profession are doing for the whole world. And what are your thoughts as we are approaching the end of this webinar? What are your thoughts? What are your insights about the questions, from the topic? Alicia?
Yeah, I really appreciate, Yelena, your comment on that. We really are leaning into a new learning curve, right? And if we really embrace the coaching mindset for ourselves and really believe in supporting our clients to help them develop their own coaching mindset, then we are really in a good position to make the world a better place and contribute to well-being. And, I think coaching was born for this era that we are in, because we are facing lots of challenges in every country across the world, and things have just intensified. And the coaching mindset is really about deepening our insights and awareness to help us learn and grow into our best selves, you know, reach our potential and beyond. And so I really think coaching what was born for this time. So yeah, so that's just more of an aspirational, hopeful thought process on this very challenging, unexpected, disruptive era that we have entered.
Yes, I've two messages are sort of resonating with me. One is that we should be aware of our internal processes when we deal with these questions and situations, and the other one that we as a profession should and move and talk, get into the dialogue with psychotherapists to be actually, because we are both in helping professions, helping our clients and fulfilling the purpose of coaching in the world of for this sustainability and making a world a better place.
Mm-hmm.
The two messages that are resonating with me. Yelena, how about you?
Me too, and especially this, it is really resonating with me, and I think with all of us that coaching is really, you know, meant to be for this time, and that we were all probably getting ready in this many years in past for something completely new that the actual purpose is. So that's good to know. And what resonates to me also is that this it's never enough, never too much to emphasize our responsibility to really work on ourselves, because it's a big prerequisite for everything else, I guess, that we are talking. And now I know that you wanted to share with us some resources before we wrap up.
Yes.
And
so you can go on to our website and the ICF website, and there's some resources that you can check out on referring a client to therapy. There's also a one-page checklist that you can print out to have handy, and then looking at the top 10 indicators for referring a client to a mental health professional. And then the World Health Organization, for those who really like to look at statistics and that type of data, is a great resource since they track the mental health issues along with, you know, a lot of other great health indicators and health resources as well.
We have I have two comments now. One is coming from Pia, and that is a question for us to send the presentation or copy the links to the chat. Okay, please, Ala, if you could help us with that, thank you. That's one thing. And the other one is I would like to ask a question which now bothers me. It's like out of curiosity. We've talked about referring a client to the psychotherapist. What about vice versa?
you're reading my mind, Brankica.
Well, I think that again,
let's get down to the real thing.
So I think if we are taking the initiative to have more conversations with psychotherapists, then that increases their awareness about coaching and how it's another resource that would be a valuable resource for those clients that have shifted into a well-functioning mindset.
Okay. Okay.
So that would be, yeah, on our end to do a little bit of the work.
Yes.
That's like in our memory for maybe one of the future events, and especially future activities, and an attitude that we would like to embrace, because it's really about cooperation, as you said, and about awareness from both sides. So, being said, we're now at the very end of this webinar, and we hope that we manage to bring this subject closer to everyone, and that we'll come out of this with at least this is the feeling that I have, and I'm hoping that everyone else is having too. We're coming out of this with a more clear picture and with more confidence about who we are, what we do, and how to dance easier in all this environment. So I want to thank you, Alicia, for this, and I want to thank everyone for participating this evening. And we obtained the CCUs for this webinar, so you'll be receiving those from us. And that is from my side. Agitze, would you like to say something?
Thank you. Thank you all participants and to the questions. Alicia, thank you very much for sharing your useful material with us and point of view. Ala, thank you for making it happen, technical terms, and being here for us on a continuous basis. I wish you a nice evening. Alicia, thank you very much once again. We hope we see you again. And we keep on talking about this issue, because we have the post-COVID era will be as interesting as other quotations as COVID one was.
Yes, well said. And thank you so much for inviting me. And thank you to the participants for showing up with your curiosity about the topic and learning more. So I'd be happy to answer any follow-up questions. And yes, definitely look forward to continuing any conversation for future presentations.
Thank you.
Okay. Well, have a good evening, everyone, and see you soon.
Yes.
Bye-bye.